research. And of course, what is the role of work environment regarding research? And of course, I will take example, we use example coming from my discipline, nursing, to illustrate this point. And of course, for each of these topics, what are the current debates surrounding this issue at the moment? First, thank you for the people presenting before me, because it was helpful. It was a very good introduction for this presentation, because our context, our postmodern world, try to cope with the consequences of the economic crisis. And of course, our financial situation in many countries could have been better. And of course, our keywords in our life are value for money, efficiency, productivity, and performance. And of course, there is some consequences as researchers and as a research team. We are now living in a globalized university, and we see what it means to have a knowledge economy. And if you are looking at our budget every year, we know that now department budgets are partly determined by the research on outcomes. And of course, we observe as well that we have a decreasing proportion of direct government funding. On the other hand, we are educating more and more people at PhD level. And the results of that is that research is more and more a competitive sector. And just to illustrate those points, there are some facts coming from the UNESCO science report, and you see the growing number of postgraduates we have, the growing number of PhD we have now in our countries. And of course, we see also that some of them will have to move to have a great mobility in the world, in the globalized world, to have their career, to follow their personal projects. So what's about research excellence in this context? Of course, research excellence is a more and more popular concept in many countries and in all of the academic disciplines. I took an example from the health domain. I tried to enter the keyword research excellence in the database Medline.med. And you see that the first occurrence came in 1961, just one occurrence, and you can observe a rise in the occurrence of this concept in the publications since 2000, with a sort of peak at the moment in 2015. So, very popular in the research field. But, and we said the same thing in a few minutes about excellence in teaching and learning, we have the same problem to define excellence in research. Of course, it seems necessary, but of course, it is a difficult task. There is no consensus, and in one hand, some scholars think that research impact should be considered as part of research quality, and on the other hand, you have other scholars saying that quality in terms of research is much more than that's research quality. Research excellence needs also to encompass impact of research findings. And I found a very interesting definition made by Mendes. She said that the purpose of research for development goes beyond generating new knowledge to generating knowledge that can improve development outcomes. Of course, because research excellence is getting more and more popular, we are now developing a lot of models to try to capture this complex concept. I took one example developed by our colleagues from the International Development Research Center in Canada. And you see that their model follows all of the different steps of the research process, proposing some criteria, proposing some questions a researcher needs to ask at each level. But of course, we'll still have a problem, because how to evaluate, to assess, to approach the notion of impact. And of course, there is a link between what is done in the research community and what is done in the world of work, where those research findings can be used. So even we have difficulties to define precisely what research excellence is. Of course, we developed some indicators, methods to assess research excellence. It was needed in many contexts, in many countries. Of course, there is a lot of debates, a lot of discussions around what could be the best methods. A lot of discussion around and amongst disciplines, because of course it's not the same thing to think about research excellence in history and research excellence in healthcare profession, of course. And there is some discussion as well about defining the appropriate criteria regarding the type of research which is conducted. But we need to move, and of course the criteria, you know, those who are commonly used are around research impact, peer review process, and metrics. Well, let's look first at impact. There is some different way to measure it and to consider this concept. Of course, the easiest way is to consider impact using the conceptual use of research in the academic field. You see there is a way to approach impact, conceptual versus instrumental use of research, or academic versus external impact. But again, if you want to cover both dimensions, you need to create indicators, qualitative or quantitative, to evaluate how you can determine how a research finding is useful in practice or in policy development, and what does it mean in terms of outcomes in outside the world of academia, if one practitioner is using a research finding and decide to change his practice. So this is for impact. What's about the peer review process? Of course, it's frequently used to get research funding, or to be published, or to communicate. But of course, it's not the perfect method. Some authors, critics, peer review, saying that there is a problem with effectiveness because there is a great part of subjectivity in peer review process. And of course, some other authors have some critics saying that it's not efficient because it could be expensive to set up and to run an adequate peer review process. What's about metrics? Everybody in this room knows what metrics means in the life of a researcher. It's getting highly and highly popular, and each of you, each year during your evaluation interview, of course, you need to deal with your metrics, because metrics, in terms of research, influence your reputation, your competitiveness when you are looking for research funding, and of course, it has a lot of consequences on your career. Of course, metrics, even some of them are more transparent and objectives than others. They are not the perfect indicators of research excellence. And again, the perfect indicators are still to be discovered. Well, now, how to develop research excellence? How to be the producer of robust, valid, excellent research finding? Well, of course, we had a very interesting study made and published by Economic Insight last year, identifying different drivers, such as human resources in terms of recruitment, development, and motivation of researchers and teams, research team, the importance of collaboration, the importance of creating and implementing appropriate research strategies, securing funding, and being able to face the pressure of competition. We also have the famous Research Excellence Initiative. They have been designed in order to, this is the aim written in those frameworks, to provide long-term and relatively stable fundings to departments in order to carry out very ambitious and complex research agenda. And again, if you are looking at the recommendation of those frameworks, you can see that the research team needs to be more interdisciplinary, and they need to create partnerships and to collaborate with other researchers in setting up projects and programs. There is, of course, a sort of attractivity to develop in a department in order to attract foreign talent and to retain them in the team. Of course, it's important to appropriately educate young scholars and to increase the visibility of research, of good research, to promote the profile of the researchers and the profile of the team. But if we want to have more impact in terms of influencing the outcomes in the world of work, we also need to promote excellence in research finding utilization. We need to increase the knowledge transfer between the sectors. We need also to develop a sort of, well, in the decision-making process, people need always to think about research finding. If I have a decision to take, well, we need to include the latest knowledge available. And it's true in different domains, of course in health, but it's also true in education. When you want to create a new curriculum, or when you want to address in your continuing quality improvement program the results you get from satisfaction or from the outcomes you get with your students, it's also interesting to know what are the methods that has been identified as the best through research findings. And of course, to achieve this aim, we need to increase the science literacy amongst potential research finding consumer. It means the professional. We need to develop competence in evidence-based practice in undergraduate programs, in postgraduate programs and also in continuing professional development activities. We also need to secure access to resources in work's environment in order for professionals to have access to maybe scientific journals, to have access to research databases. So, what we need to do to articulate the world of research and the world of work. We need to create a virtuous circle, and this virtuous circle means identifying the right research questions. The right research questions, the priorities in terms of questions, need to come from the world of work. And of course, in the world of work, sometimes you also find a lot of innovation, of innovative practice. We need, of course, but we are more, you're more familiar with that, doing research in an appropriate way in terms of going from research questions to research findings. And when you get the results, to stimulate knowledge transfer. Not only to be sure that your paper will be accepted in the right scientific journal with a high impact factor, but also to try to identify methods in order that people, practitioners, people living in the work environment will have access to this article if they need a solution, if he is facing a problem in his everyday practice. And of course, if you succeed, if the research finding is included in the decisional process of the practitioner, you need also to assess the outcomes. Does it change positively the situation? Does it bring an improvement in the situation? And creating a virtuous circle also means to build synergies. Synergies between researchers, synergies between teachers, synergies between the managers who are organizing and creating a positive practice environment in their team, synergies with the professionals, and synergies with the policymakers or the regulators. The questions was about the rules of the profession before my intervention. In the field of healthcare, we have developed some comprehensive model in order to articulate all of those elements and to create this virtuous circle. I give you as an example the model developed by our Australian colleagues working in the Joanna Briggs Institute. It's an international organization based in Australia and specialized in evidence generation in the field of healthcare. And if you see this diagram, you see that all of the different aspects of the virtuous circle are there. Because, well, this is the world of research. You create some knowledge based on the problems identified in the world of work. When you get findings, research findings, then you can combine those findings and create a synthesis of this research finding to promote recommendations, guidelines. And again, it's important that those guidelines came into the world of work in order to stimulate a change, stimulate a self-assessment, stimulate the continuing quality improvements in place in hospitals or in community healthcare team. And again, if you put the energy to change your practice, to put those research findings into practice, never forget to evaluate the outcomes. Well, was it positive to do that? We put some energies, we had to be sure that people are not too anxious to change their practice, so where are the outcomes? What does it mean in terms of patients' health? Is it an improvement? So evaluation is always very important. So this is the virtuous circle. We need also to identify the way all of those people need to work together to create these synergies. Of course, healthcare professionals need to talk to researchers. Sometimes healthcare professionals are practitioners but also researchers, but sometimes not. Those researchers need to do their job to produce robust research findings, to disseminate those findings. The research society need to get all of these scientific materials to produce the recommendation. And then those recommendations could be transmitted to the place where those recommendations can be implemented. And then again, we are coming back to the healthcare professionals, and again, we are working to more quality of care, patient safety, and of course an increased performance and efficiency. But of course, we need some oil to lubricate all of these elements, and I would like to attract your attention about the role again of education on healthcare professional, on teacher, on manager. They need to be educated to develop this specific competence about evidence-based practice, how to use those research findings in the continuous quality improvement program, and how they can get the resource they need to put all of these elements in place. And of course, it will be only possible for healthcare professionals to use those research findings if they are working in a positive practice environment. And again, it's the responsibility of managers to create this positive environment. So to conclude, as you see, research excellence is a challenge for us, it's an opportunity, and it could be a threat. We need to develop a more comprehensive approach to these concepts, and of course to create more comprehensive theoretical frameworks to catch this complexity. We need to remember that in many of our disciplines, research is a mean, not an end. A mean to achieve better outcomes, and it's particularly right in healthcare. And of course, research excellence means impact, but impact means bridging academia and work environments. And of course, we need to prepare future researchers. Of course, we need to prepare future research finding consumers, but also we need to prepare in our higher education organization people able to work together in synergy. So, thank you very much.